Good morning. My name is Lori Yackanicz, and I'm here to introduce the second panel of the morning on patient engagement. I'm from the DVHIMSS organization. I co-chair the program committee with Jack Hueter. They're telling me, okay, here, yell into it really, really loud. That's what I'm doing. Can you hear me now? Yeah? All right. I'm sorry about that. Okay, I'll start again. My name is Lori Yackanicz. I am a co-chair for Delaware Valley HIMSS with Jack Hueter. We decided to tag team this morning. I'm going to start with the introductions, and then Jack is going to follow up with the questions at the end. We have a great panel today, 2 providers and a payer. I'll introduce them now. Kristen Raber is presently employed at Christiana HealthCare Systems in Newark, Delaware, as a project manager for the Department of Information Technology. She focuses on the implementation of high-priority enterprise solutions for patient satisfaction, clinical excellence, and employee satisfaction. Previously, Kristen has held positions as a field scientist in an international consulting firm and as an information technology project manager for a Fortune 500 company. Kristen holds a Bachelor of Science degree in Biology and Sociology from Emory University and a Master of Science degree in Biology from the University of Alabama at Birmingham. Our next speaker is Susan Lawrence, who is a Senior Vice President of the Care Continuum at Lehigh Valley Health Network in Allentown, Pennsylvania. Sue holds a Master of Science in Healthcare Administration from the University of Scranton and a Bachelor's in Health Information Management from the University of Pittsburgh. Previous roles at the institution have been Vice President of Care Continuum, Administrator of Quality. Other accomplishments, she co-leads various major initiatives at the hospital, and she also belongs to various associations and has presented at many national forums on Care Continuum. Our final speaker of the day is Joe Miller from AmeriHealth. He has served over 20 years. He has over 20 years experience in healthcare IT, working in the provider, payer, and government sectors. He's currently Director of eHealth and Innovation at AmeriHealth Caritas, where he developed innovative solutions for the delivery of administrative and clinical information sharing for 10 years, with the plans to address the needs of the underserved. He has worked at the local and national levels on a wide range of industry topics, including health information exchange, 5010, ICD-10, Care Continuum. He's a HIMSS fellow and also a current DVHIMSS board member, past chairman of the HIMSS Financial Committee, and author of Implementing the Electronic Health Record in the HIMSS publications and numerous other publications. So we're going to start out this morning with Kristen, who has the opportunity to work on a project called the Get Well Network Initiative at Christiana, which shows us, and she's going to tell us how this application really helps with patient engagement.
Hi, good morning. Can everyone hear me okay? I'm usually pretty loud. Are we good? Louder? Whoop. Bend in closer. How's this? Better? Okay. A little awkward, but I'll do it. Okay. So good morning, everyone. Thank you very much for having me here. My name is Kristen Raber. I work for Christiana Care. Just to give a little background on Christiana Care, it is a 2-hospital system located in Delaware. We serve Delaware, Maryland, New Jersey, and Pennsylvania. We had about 52,000 admissions last year, and we have about 1,100 beds and about 10,000 employees. So we like to think that we're a pretty good size. So today I'm going to talk about Get Well Network. Get Well Network is an interactive patient care technology that we have at the bedside, and I have a picture of it up on the screen. We have 2 solutions in place. We have a solution where it's a touchscreen solution right by the bed, and then for those areas where that's not appropriate, such as our ICUs, we actually have it up on the wall as well. So Get Well Network allows our patients to really become engaged in their care. There's many pieces to it. There's communications, there's surveys, there's the ability for them to go on the internet. I'll go through sort of all the functionality that it provides. So we implemented Get Well Network in 2006, and we currently have it in about 850 beds. So we still have a few beds to be implemented this year. I'll find my clicker. So one of the bonuses of Get Well Network, one of the things I like the most about it is its ability to help us with our communication with our patients. So we actually do ask survey questions to our patients. They get it on their second day of stay. It's 10 questions, and it gives us an opportunity to really react immediately to any issues that we're seeing from the patients. So they can go in, they can click through the 10 questions, they get a free movie at the end of it, which always helps with patient engagement. That's a big positive. Actually, it was so engaged that we actually found that patients were answering it like 5 times during their stay. So we kind of had to shut that down a little bit. But we do, the emails go out immediately to the managers on the floor, or if we ask like an environmental service question, it'll go immediately to the environmental service manager. We have an SLA that our managers are to get back to the patients within 15 minutes with any issues that they have. In addition to that, they have the ability to free text any issues they have during their stay. So we actually get some really great responses, and we get stuff that, about nurses and how wonderful they are and the things that they've done. We hear about our doctors. We hear about our environmental services. We hear about just about anybody that touches the patient. In addition, we get, some more amusing ones. We had somebody who asked for concentric circles of kiwi and grapefruit on their plate. So we really get... And it'd be great if we had starfruit. So we really get a wide range. I would say about 90% of them are positive, which is fantastic because it really gives our staff that sort of immediate feedback and that boost. And some of the stories that have come across have just been so completely heartwarming. And we share it across the board with our leadership, and we actually post a lot of them as well. In addition, we get, some comments that, are a little bit more worrisome. Those comments as well go to our executives and to our managers, and it helps us sort of make sure that those staff members are either re-educated or, as our CNO puts it, maybe they need to get off the bus. So, sometimes, the good news is, like I said, you get that immediate insight. Okay. Another nice thing about the communication is that you're sending out a message and you're hitting all of your patients at once. So in many cases, such as we had an emergency security announcement that went through about 2 years ago. We had an individual who at our hospital was performing inappropriate exams on patients. And unfortunately, it took us a little while to figure out who it was. It was not somebody with the hospital, but they were managing to get into the rooms. And so that was actually an issue that made it onto national news. And, it was something that we wanted to be able to get the message across and let our patients and our visitors know what we were doing to address the issue, and also tell them to make sure they check badges and if they had any questions. So the Get Well Network was a way for us to immediately get that information across. It's actually been such a good way to bring information to our patients and to our staff members that they actually have come to expect it from us. When we had like an earthquake about 2 years ago, I was on vacation, and so I didn't know till I came back because I was up in the wilds of Canada. And I didn't know till I came back, and I found that the staff members were actually thinking that we were going to post the message on Get Well Network explaining the earthquake. And at that time, it took us about 2 hours to get a message on, and we didn't realize that they were looking for that information immediately. So we've actually learned that the system is even more valuable than sometimes we give it credit for. In addition, we have online translation services available, and we're able to put out a lot of information about our flus, policies, and other additional information. As well, if there's things going on in the hospital, we can put information out there, such as heavy cleaning notices we put out there, smoking cessation information. We actually target patients that we know are smokers and send them the information directly. The CEO, we have a wonderful, Dr. Laskowski, our CEO, has a wonderful video that we put on the Get Well Network, and they actually are sort of forced to see it. It's sort of like an airline. We think of it as an airline safety video, right? You get on the plane, the video comes on, you don't have to watch it, right? You can avert your eyes, but we're going to play it for you. Now, for those who are our frequent flyers at the hospital, we do have the ability to turn off, the nurses can bypass that for that individual. We also do a lot of fun things on the system as well. So for your birthday, we send out a birthday alert. We found out, actually, we didn't realize we give away a free movie for your birthday. We were actually giving a free movie away to our newborns because we didn't realize, we didn't realize they were registered in the system. And all of a sudden, the daddy in the next bed got to see, because that's where the newborn got registered to, got to see the free movie, and the mother didn't. So we had to fix that. And then in addition, we have a lot of games that are available. Those are really popular with, not just the youngsters, but, of all ages. We have gift shop information. One of the things you see in the middle actually is Get Well Town. So we have a standard look and feel for the majority of our patients, but for our pediatric patients, we have sort of that interface. It's a little bit more sort of those familiar with it's sort of more that look and feel. It's a lot of fun. I'm actually one of the advocates. I kind of want to do it across the board, but I haven't gotten the okay yet. In addition, we have hospital maps and information on there, guides. You also have the ability to search our lost and found for an item. I'm surprised how many glasses and pairs of teeth go missing, but there are quite a few on our database. Oh, and I forgot Track Santa. That's always a big one at Christmas. We always put a link on there for them to track Santa on NORAD. Okay. In addition, we've started focusing on cultural diversity and special needs. So you do have the ability, you can actually, you can order a pet online to come visit you, which is very positive. We started putting out some of the holiday recognitions. Now we want to be careful of all cultures, so we've sort of picked some of them like 4th of July, Thanksgiving, New Year's, and then we're slowly sort of rolling out some of the other holidays. We always put sort of fun facts in there about the holidays. In addition, we also have the ability, you can schedule somebody to come in. If you have a special cultural need, we can send a message directly to our patient experience officer, and they'll come in and take care of that as well. We have a few initiatives as well. I'm losing my necklace. The nice thing about Get Well Network is actually that you can customize it just for a particular unit. So we've actually had a lot of nursing units that have put their own initiatives into place. So one of them that's been pretty successful is bedside reporting. Now, we had bedside reporting sort of going on across the board. However, there was really no way for the nurse managers to really know if their staff were engaging in it. So through the Get Well Network, we were able to put out there a survey to find out exactly, who's reporting, if they're actually engaging the patients, and we can find out if there's any issues in that particular unit. That's been so well received, we've actually started rolling that out to multiple units. In addition, pain management is another big one that we're working on. So we do have a pain management survey that goes out. If you see to the right-hand side, the managing your pain, the little faces, that is sort of one of our next phases to put it out there. So in the future, when you get a pain medication delivered to you through Cerner Power Chart is actually our EMR for inpatient, we would actually be able to know when that patient was delivered that medication, wait a certain amount of time, and then pop up and ask them how their pain is doing. Patient education. So we have over 350 health medication and safety videos available on the system. The really great videos are only a couple minutes long, which we find is about the average span of attention that most people have for those sort of videos. The nurses, we actually have through Cerner Power Chart, the nurses can order the videos online just like they would for any other order. That order comes through, the patient can watch it, and then that order is actually fed back to the system. So you can see down below is sort of our Cerner solution. You can see the orders are actually coming through. So we know who watched it, we know when they watched it, and we know if they watched the whole thing or just part of it. We have another integration with Cerner Power Chart where we actually have the medications coming across. So as soon as you're ordered a medication and it's been verified by our pharmacy, that information is sent over via an HL7 message to Get Well Network, and it will display your list of medications. Now, you have to have a special password to get in to see your medications, so we do protect you from the family member that's just playing on the system. High alert medications are always to the top of the system, and medications that you've already seen are actually, we check mark them so you know which ones you've seen, kind of gives you an idea of your progress along the way. If there is a medication video associated with that medication, that gets auto-ordered for you as well and shows up in your video list. So I deliberately went short. I think I'm doing good on my time. So I'll just go through my highlights real quick just to give you an idea of some of our success. So as I mentioned, we had about 53,000 admissions last year. And we had about 19,000 people using the education material, 55,000 using our health education videos. Now I have to say, before we put this system in, that number was about 200 for the year. Yeah, because the system was so complicated. It was a telephone system that you had to call up through and do an order, and you had to tell the patient what, where to listen and what channel and what time. And so really it wasn't being used. So that has been major for us. As well, we know that almost 78,000 medications were reviewed in the system as well. I actually can't even tell you how good that was because we had no way to track how the medications were being viewed previously. Before, our nurses were going in with, some Xerox pieces of paper, and they might go over one or two of your meds, but they certainly weren't going through all of your meds. What we've also found with the medications as well is that on average, every time we show a patient their medication, they on average go into 5 to 7 meds to view them. And staff recognition, we had almost 12,600 patient satisfaction surveys and 1,400 patient comments come through. So we have a very active population. It's always surprising, we hear a lot sometimes from nurses, my population won't use this system, my population's not interested. And what we've found is pretty much across the board that's not true, because even if your patient's not using it, there's a good chance that their family members are. And so it's not just about engaging the patient, it's about engaging their family members as well. And I think that's it. I'm good on time. Thank you all very much.
So if you look at this panel as a story, we started in the inpatient arena with patient engagement. Now we're going to move to the care continuum at Lehigh Valley Health Network. Sue is going to talk about the various applications that she's implemented to actually go beyond the inpatient setting into the care continuum.
Thank you, Lori. Okay, can you hear me? Maybe shrink it a little bit. Can you hear me now? Okay, good. So I'm Sue Lawrence, just to reiterate, and I've been with Lehigh Valley Health Network for coming up on 28 years. Yes, I was 15 when I started. And I also had the privilege of working with Dr. Bob Laskowski, the CEO of Christiana Care. He was our chief medical officer for a period of time at Lehigh Valley Health Network. We are a very similarly sized organization as compared to Christiana. We are a 2-hospital system located in Allentown and Bethlehem, Pennsylvania, and we're about 90 minutes north of Philadelphia, and treat really about the same amount of patients, between 55 and 60,000 patients annually, and close to 1,000 beds. And we also have 10,000 employees, and we are the largest employer actually in the Lehigh Valley, followed by our other healthcare provider, St. Luke's. So as I thought about my comments for this presentation, I thought about how I think traditionally hospitals have viewed consumers and really how consumers have viewed hospitals and healthcare systems. And they've really viewed us as a place to go when they're sick. But really, if we're going to be successful in terms of population health management, we need to be able to really engage our patients much earlier in the process of their disease or even disease prevention, and really begin to get patients and consumers to view us as a place to go to seek information, to stay healthy. And so that's a big culture shift for most healthcare organizations. as I did a little bit of research in terms of trying to think about how to organize my comments, I came across a recent report that was put out by the American Hospital Association, and it is all about consumer engagement. And they developed a framework that I think is kind of useful that I use to go through our organization to really give you a flavor of what we're doing across the organization in terms of consumer engagement, with the overarching goal really of improving the health of the population. The AHA really outlines this in terms of 4 different components, looking at the community level. So how are we engaging the community in wellness and prevention? How are we engaging our organization as a whole? And I think we have found that we've had some opportunities there. How are we looking at this from a team perspective in terms of the various teams that we have throughout our organization? And then finally, to piggyback on some of the comments that Jennifer made, how are we really looking at the individual patient level and really tailoring our efforts to meet the needs of the individual patient or consumer? So as I looked across our organization and I looked at our community strategies, we had many of the things that many of you might have in your organization if you come from a healthcare organization. We've had print materials. So we've had Healthy You magazine that's been designed to try to engage patients in their health and wellness, and of course with the ultimate goal of eventually driving them to our brand if they do need to seek healthcare. But we've branched out further and tried to offer wellness classes and cooking classes and things like that, so that we're really engaging the consumers in the community and becoming more of a resource for them. We also took a look at our website. When we looked at it and realized what it looked like from a mobile application, we knew we had some work to do. And if you look at our website today, lvhn.org, I think you'll see that it's organized quite a bit differently than it had been years ago. And it allows you quick links to be able to get what you need, like visiting hours and directions to our various locations. So we've tried to take a consumer view to that as well. We also looked at our data. We talked a little bit about data earlier this morning, and we realized that, we're a tertiary care facility. We have a very large trauma program, and one of the leading causes of accidents and injuries was distracted drivers. And so within our organization, we mounted a campaign targeting our students in high schools as well as the entire community, and really mounted this whole Stop Texting campaign. Now, how many of you have ever seen that red, looks like a stop sign and says Stop Texting? Okay, well, they're all over the Lehigh Valley. Oh, thanks for raising your hand there. And they've made it pretty far and wide, but it's a pretty powerful statement from a healthcare organization that really hopefully will drive down the number of accidents, which drives down the number of folks that we need to care for, because it's the right thing to do. We also have something called community exchange within our organization. It's a time banking concept where patients who might need services after they leave the hospital but aren't able to afford to receive those services, maybe they need transportation, and they don't have anyone in their family that can take them to their appointments, we can link them to this community exchange where they can actually donate a service that they have or something that they do. Maybe they can read books to someone who's homebound, or do something on the phone for someone. So it's this concept of giving in order to receive, and really engaging the community in ways that they're not viewing the healthcare organization as something that's always just there to provide service that comes without cost. I need water. Thank you. Sorry about that. Thank you. Another thing that we've done to engage partners in our community, again, we realize that we can't do this alone. Although we're a very large organization, and we like to think that we can satisfy the needs of everyone in the community, we need to look to others to partner with in terms of engaging our patients. And we developed something called community forums to engage our post-acute skilled nursing facilities in a partnership to say, how can we do a better job with transitions of care? how can we try to decrease our readmissions? Providing report cards and engaging our post-acute partners in this work has helped us really reduce our readmissions by about 20% for patients that are discharged to skilled nursing facilities. From an organizational perspective, we looked internally a couple of years ago, really back in 2005, 2006, and we realized that maybe we weren't as patient-centered as we thought we were. And we invited a lot of community members in, as well as a lot of members throughout our own organization, to participate in a day-long retreat with us to really look at what it means to be a patient at Lehigh Valley Health Network. From that retreat, we included 400 to 500 people, and we generated over 1,000 ideas for things that we thought we could do better, we thought we could do differently. And now we've engaged in a 10-year process to take all those ideas and try to turn them into different strategies that we can utilize to really turn our organization into much more of a patient-centered organization. One of the ideas that came out of that was a patient advisory council. Many of you maybe already have that, but we didn't at the time. So back in 2006, that was a new idea for us to get patients and families involved in giving us advice. Another idea that came out of that was family present. Historically, we had really clung to our visiting hours. And, you know, we had very strict hours, and it was announced promptly at 8 o'clock every evening that visiting hours are now over. And you'd see this mass exodus of people leaving. But for some people, that wasn't really the right answer. People wanted to be with their family members for the entire stay. And we needed to get ready for that and be used to that. So we really adopted this philosophy of family presence. And if you look at our website today, you'll see that we don't have restrictions on the visiting hours. We do encourage folks that are not well, you know, if they're ill, to not come visit, but we generally don't have restrictions on the visiting hours. We also realized that we needed to do a much better job engaging our own workforce. So, you know, if we're going to engage patients in their wellness, my goodness, we're 10,000 people strong. What are we doing about our own population? We're self-insured. Choice Plus is our insurance. And for our employees, the insurance is free. So just this year, we mandated that people needed to select a PCP. So we're not raising the bar too high here, but they actually had to select a PCP. They had to complete the health risk assessment. So up to this point, the health risk assessment was voluntary. We actually gave them like a gift card if they completed it, and we had a very low completion rate. You know, maybe 100 people did this. So now it was mandatory. In order to receive the free benefit of your health insurance, you had to complete the health risk assessment so that we can begin to do a better job managing our own population. And finally, we engaged in an educational strategy utilizing our e-learning throughout the organization. The folks had to engage in that and take that. And if they did that, they will receive not be charged for their health insurance. But if we actually had 2 employees that did not engage and are now paying the premium for their health insurance for this year. In terms of looking at different team strategies, Kristen mentioned bedside shift report, and I really aspire to have the monitoring that she's got going with the Get Well network. We don't have a way of monitoring this, but we did roll this out. And again, the concept is the nurses do bedside shift reports, so they're exchanging information at the bedside, engaging the patient in the process, and engaging the family. I'm going to talk to you later to see how we can get the monitoring activity. Another thing that we implemented from our EMR was a daily roadmap for our patients, so that they're given actually a little roadmap that tells them what tests they're going to have performed that day, which physicians they saw that day, and they can use it to jot down notes to talk to the physicians or other providers that might be in the room with them. It helps with families when they come to visit later, and they can pick up that roadmap and actually engage in a conversation with the patient. We also recognize that it's not always the patient in the bed that needs to be engaged in the conversation. So one of the things that we learned as we went through an IHI collaborative on improving transitions of care was to identify the key learner. So it's not always the patient that needs to understand the information about diet or medications or the follow-up visits. It really might be the family member that's driving the patient to that visit. And so we've embarked on an endeavor to record the key learner on the whiteboard in every room so that caregivers, team members coming into the room will know who to engage in that conversation. We've also used TeachBack, which I'm sure many of you have heard about, but at our organization, for us it means we use humble inquiry to ask patients to tell us if we've done a good job with teaching. So this is not about testing the patient, but this is about finding out if we've done a good job educating them and asking them how they would describe what has occurred to them, or how they would describe their illness if they went home to their neighbor in the backyard. And we use 3 days worth of questions looking at knowledge, attitude, and behavior. So the first day we might say, what is the name of the water pill that you have to take if you have congestive heart failure? The second day we'll say, why is it important for you to take your water pill? And then the third day we'll ask, how will you remember to take your water pill? So from a technology perspective, we built that into the nursing order set so that that information pops up in their screen so that they remember to do it. We have also embarked, as you heard earlier, on our patient-centered medical home journey. We have 9 practices that are level 3 NCQA certified, but we heard from our practices that this is very hard work, and we don't have the luxury of the staffing that you saw earlier from Anvil. I'm very jealous of your staffing there in terms of care management. But what we did do was we decided to share resources across practices. So we developed what we're calling community care teams, and we have a social worker, a nurse care manager, a behavioral health specialist, and a pharmacist that shares their expertise across a number of practices. So they spend their time in the practice and help specific high-risk patients for within those practices. And we've actually seen a 60% reduction in hospital utilization following our intervention with those patients, looking 3 months prior to our intervention and 3 months after. So, really trying to get to that triple aim of decreasing the cost of healthcare through engagement of our population. Another team that we have that's working in our network is our palliative medicine team. Somebody asked a question earlier about palliative medicine, and we've demonstrated a 50% reduction in utilization after our OASIS team has been involved with our patients. From an individual strategy perspective, some of our technology that we've employed includes Emmy. Hopefully you've been able to stop by and talk to Cheryl, give her a little plug and a shout out. But we have embarked on a pilot where we are utilizing Emmy, which is a web-based product that allows us to push links to educational material to our patients via their mobile devices or their laptops. And we've seen really good success with our obstetrics program, where we've been able to engage our patients in this process, and they've reported a great deal of satisfaction. 67% said that they were more motivated to take their medications following review of the Emmy videos that they've been able to see. 71% said that they were more aware of how lifestyle impacts their health. Vocera, Good to Go, is a new pilot that we just implemented actually about a month ago. And it's a discharge instruction pilot where the nurses actually record their discharge instructions so that the patients or their families can listen in after discharge to those instructions in case the patient or family has any questions about the discharge instructions. We know that the time of discharge is very nerve-wracking for patients. They're not concentrating on the discharge. They want to get out of the hospital, and they'll say yes to anything. Yes, I understand it. Yes, I want to, yes, I have somebody to take me wherever I need to go. And so we're just, again, starting on this, and so far we've seen about a 14% access rate. So we're hoping to drive that up. We initially got over the hurdle of having the nurses be a little bit nervous about having their voices recorded for people to access later on, but we did overcome that hurdle, and we've got 97% compliance with the nurses actually recording the discharge instructions. So now we need to get the patient and the family engagement up in terms of accessing it. We've also used another piece of technology through a company called Vitel, where we've done a mammography campaign where we had women who had been approached by their family medicine or their internal medicine physicians several times about obtaining a mammogram, and they had not followed through. So this specific target population was selected to receive automated phone calls, which is what Vitel does, provides automatic reminders to close care gaps. And we've seen a 10% conversion for those patients that received the Vitel phone call in follow-up. We're using health coaching with our employees and in our community care teams. We're using a motivational interviewing technique called Flinders. I don't know if any of you have ever heard of it, but it really gets to some of what I think Jennifer was alluding to in her talk earlier with what's really important to that individual patient. What do you want to achieve over the next month in terms of your health goals? And kind of turning it away from a disease-specific focus to really personalizing this with the patient and what's important to you. How can we get this to the next level? So we've had a fair amount of success with that. Again, very high touch, very time-consuming activity. Those interviews take about an hour each. And in terms of the future, what we're doing, I'm very excited to announce that we are moving to a new EMR, Epic. And from the Care Continuum person here, it represents to me this, totally integrated record that we're going to really be able to see our patients completely across the care continuum. I was at an educational conference with a group of primary care providers a number of months ago, and they asked me, to show them, first of all, they were complaining about the fact that they didn't receive discharge instructions in a timely fashion, and how could I help and do a better job with that? And I said, well, they're right here. They're in our system. You're all connected. We have the same EMR on the inpatient side and the outpatient side. And then I proceeded to go through 9 screenshots, 9 clicks to get to those discharge instructions, and realized, what a challenge we placed before our primary care physicians just to really see the discharge instructions, the medication list. So for me, Epic represents a real improvement for that. And in terms of our patients, in terms of the ability to schedule and look at their own medical records, this will be a real step forward for us. So I tried to stay on my time, and I think we're moving over to Joe.
Thank you, Sue. Now I'm going to introduce Joe Miller. He is going to bring the payer perspective now that we've heard 2 stories from the provider side.
Thank you, Lori. Really happy to be here today with everybody. I'm Joe Miller. I also have a Christiana Care connection too. I worked at Christiana Care prior to coming with AmeriHealthMercy at that time. So many of you might be a little confused about our name. We did, in fact, change our name a couple of weeks ago. We are now called AmeriHealthCare. Caritas, the Latin word for caring. We ended our 20-year relationship with Mercy Health System about a year and a half ago, and then the Mercy name came out. So here our corporate organization is known as AmeriHealth Caritas. Many of you might have known us here in the Lehigh Valley as a Medicaid health plan called AmeriHealthMercy. Now that's AmeriHealth Caritas. And in the Philadelphia area, we used to be called Keystone Mercy, and there we're called Keystone First. So that's the end of the name discussion there. Let me go ahead. Okay. All right. Good, thank you. So let me say I'm going to talk a little bit about us as a health plan and what we do. I'll also talk about how what this patient engagement landscape looks like, and I think it's getting a lot more complicated. And I probably have more questions than I have answers today for you, but at least we'll get those out on the table and maybe we can talk about them a little bit. What's the health plan role in all of this? And then what's the role of innovation and mobility? So a key part of my talk today is that, less and less care is happening in the hospital, okay? Admission rates are falling, at least in the Philadelphia area. I know those stats pretty well. And they're expected to fall, throughout the country. Care is being delivered more and more outside of physician offices and hospitals and more in the home and in everyday lives. How do we engage patients who aren't going into the office, okay, in their health care? So I think that's an important challenge that we have as providers and health plans and others that are in healthcare. And those are the number of questions we'll have around that in terms of how we deal with that as an industry. So we're a Medicaid health plan, managed care health plan at AmeriHealthMercy. We run Medicaid managed care plans throughout the country. If you don't understand what a Medicaid managed care plan is, let me briefly explain it to you. States used to provide Medicaid through a fee-for-service program where you as providers would send in a claim, the state would pay it, and all was good, okay, for everybody, except costs started to go through the ceiling. And many states today pay far more in Medicaid, okay, than they do in primary and secondary education. And as a way to address that challenge, that financial challenge, states began to take and subcontract effectively with organizations like ours to deliver as a health plan services to members, have a network of providers, but also do more than just deliver and pay for claims, actually help to manage those services and those members, particularly those members that it's been talked about before who are chronically ill, comorbidities, and who cost our system probably account for about 80%, 75% of the cost of the healthcare system. So that's what a Medicaid health plan is. People come first for us. We're a mission-based organization, really improved on improving lives. We have a very big component of the services we deliver and coordinate around behavioral health, because as we know today, many of the challenges are not just physical health challenges, but a combination of physical health and behavioral health challenges for our members. One of the largest Medicaid health plans in the U.S. We are the largest here in Pennsylvania, about 500,000 members between our multiple plans here in Pennsylvania. In the Philadelphia area, about 320,000 members. So this landscape of patient engagement, I think is kind of complicated. We've heard some great presentations today around how things are handled in a physician office, how things are handled in a facility, care is coordinated, but it's getting more and more complicated to address. How do we address these things? And we see this patient in the center, child in this case, okay, with a smartphone who looks kind of crazy because it is getting more complicated, and members and patients have many, many more choices today than they had before, okay? And we need to account for that as we plan our patient engagement and member engagement activities. We're certainly thinking about that as a health plan. I'm sure you experience that as providers every day as members come in and bring in their smartphone. I'll give my own example of thinking, sometimes I get a little crazy and I think I'm going to have a heart attack. And so I went to the emergency room. It was about 2 years ago. And I said to the doc there, I said, my heart rate's like going through the roof, He says, well, how do you know that? I said, well, there's this app on my phone. I turn it on. I put my finger over the flash, okay, and it measures my heart rate. It does. You can download these. They're fairly, available and simple and so forth. He was like, geez, okay, well, let's get you back. So I was fine, of course, there was no problems. I was just got a little crazy. But I mean, that's not an unusual thing. We all get crazy about our health sometimes, right? And then we take one of these little apps and we say, this rash, I think the rash is, I've got melanoma, so people are, more information is very, very helpful, but we have to understand how our members, how our patients are getting that information and the challenges that they have and occur for them as a result of it. So on the provider space, and we've covered that a lot this morning, a lot of education, training, and monitoring. And I split this up. I don't know if this is proportionate or whatever, but yeah, most of the information patients get today is from their provider, okay? And we as a plan want to support that. But plans also have information they need to deliver to their members, right? And so there are a whole bunch of convenience apps there that plans have. Information apps, how to find a new provider, where's the closest hospital. We'd prefer you to go to the urgent care center, so we put that up there first, but where, if appropriate, but where, all kinds of informational apps, some alerting apps and I'll talk a little bit more about those, and some coaching apps, and that's one of the areas we're looking at. So today, almost every health plan provides, a smartphone app that provides some of these kinds of information. But where it's really expanding, where it's really getting big is in that bottom right-hand corner, the retail consumer space, okay? The apps that are coming out there are enormous, okay? And there's a lot of activity. There are all kinds of entrepreneurs, I'll talk about a little bit later, that are going out and trying to figure out how can I create the next app that's going to really get a lot of uptake, really address key issues, really enable patients to take control of their health care better. So, and those include informational apps, tracking apps, diagnostic apps like the one I had, although probably most clinicians would say that's really not diagnostic, and convenience apps that are out there today. So there's all of this activity that's going on, and some are pretty neat. Some are really cool. Other ones, will fall by the wayside. So, from a health plan standpoint, our member engagement activities, why do we care? Okay, well, we care because, number one, we want to make sure our members have the right information. We want to make sure our members are getting the care that they need. Okay, so one of the things that we do as a health plan, and many others do, I know, is we track care gaps. It was mentioned earlier. Okay, so we track care gaps. So every time a provider goes into our portal and checks on eligibility, we not just tell them whether you're eligible or not, but if you are eligible, are there any overdue care gaps that you should be, checking on that member today as the provider? As well, and that same information on care gaps is not only delivered when somebody checks eligibility, but when a member calls. Okay, regardless of whether they're changing their PCP or they have a complaint or whatever, our call center staff see up on their screen, oh, Mrs. Jones, you're overdue for your mammogram, and they have a script to read back to that person. Your child is overdue for a preventive health screening. So that information is pushed today. Now, one of the things we did, we tend to use fairly traditional methods for that, but one of the things we did about 2 years ago was we decided, well, can we push any of that information via text messaging? So we had a pilot out there that went out to about 10,000 patients, members, identified if they had care gaps, and then we actually pushed text messages out. Now, because of HIPAA and so forth, those text messages couldn't say, and because of the control over your phone, they couldn't say, Joe, you're overdue for your colorectal screen, get in to see the doc, okay? They had to say, men over 50 years are recommended to have a colorectal screen every 5 years. So it was a little less effective, but it was a first effort to kind of see what could we do around smartphone use, or in this case, any cell phone use, in terms of providing alerts and so forth. It didn't go over that well, to be honest, okay, 2 years ago. But as we've had more and more discussions with focus groups and looking at our opportunities, we see text messaging as a key component of any overall member engagement strategy that we're going to pursue. Because members come back and say, What do I listen to? I do look at my text messages, okay? And I do respond to those. And when you send a text message that has a phone number in it, all I have to do is push the button, for that phone. The phone call is made either to our staff who will arrange the visit or directly to the physician's office. So there are a lot of opportunities out there. But today, primarily to support disease management and care management, we're using the traditional tools. Some phone calls, some mail, community health workers and navigators. That's got to change, okay? That's got to change. Because if we're going to change, the curve of the healthcare costs, and we're going to appeal to members where they are. And where they are is right here, okay? They're not accessing the web anymore, okay? They're right here on their smartphone, and this is how they live day in, day out. I shouldn't say they, we, right? Everybody in this room, okay, uses their smartphone constantly. So, and that's not a complaint that you're not listening to me. But, as we think of Medicaid members, we think, why would Medicaid members really have? Absolutely. Are their numbers a little bit lower in terms of smartphone use or access than for others in the population? Yes. But increasingly, they are using this because it's a lifeline, okay, for them. It was interesting about 2 years ago, there was a reporter from the Washington Post who was interviewing for something else a lot of homeless folks and found that cell phone use, which was enormous among these homeless folks. Well, duh. They don't have a home to go and a landline, that they can afford, but they need to be connected, and the way they stay connected is with their cell phone, okay? Our members exactly the same, okay? They're not using the web or PCs to get to the web anymore, okay? They're using their smartphone, okay? Information channels, this is a key for, I think, all of us to understand, to those members does not only include us as, you as a provider, us as the health plan, but there are many, many more channels out there that deliver information on health and healthcare for our members. Care's moving, obviously, from the hospital to the home, as well as from physician office to home. Really, if we think, and it's not healthcare activities occur more healthcare activities occur outside the doctor's office, it's more health activities. When you think about it, how many times do you go to the gym or take your walk or pay attention to what you're eating? Those are all things that's not, you're not doing that in a doctor's office. You're doing it, in your home, on your own time, and so forth, okay? We have the opportunity with these devices to change behavior at that point of where health is really engaged and where people participate in their health. And then, of course, social media throws a whole bunch of challenges out there from a privacy and kind of standpoint. So let's talk a little bit about some of the innovation that's going on today. Asthmopolis, anybody here Asthmopolis? Okay, yeah, a couple of folks. Okay, so I have asthma myself, okay, and Asthmopolis is a little device, okay, that goes on top of your inhaler, okay, and every time I use that, sends a little signal, Bluetooth signal to my cell phone, and that data is recorded. Now, what's recorded? When I use it, how many times I use it, and where I use it. Wow, where I use it. So from a public health perspective, if every asthmatic had that on their device, we might actually be able to tell what section of Philadelphia or sections of Philadelphia appear to have more pollen or other kinds of elements in the air that drive asthma rates up or utilization up, okay? Amazing that, so this is a little device, okay, that one of our competitors in Florida, I think it's AmeriGroup, allows physicians to, will pay for this if physician orders it for the member, okay? So they'll pay for this. I think very interesting kind of approach there. You've got the AliveCore device, which takes an EKG, put it in your pocket, a couple things on, takes an EKG, sends it right back at any point in time. $199 in cost for that device, okay, that hooks up to your smartphone. We're not talking thousands of dollars, $199. obviously the price is going to come down too as there's more adoption of it. Some of you may have heard of ZocDoc, okay? ZocDoc is a little app out there that I can go in and I can schedule an appointment with various physicians' offices directly because it pulls data from their practice management system, scheduling system. And then there are a whole host of other devices out there that are going on, devices, applications, and so forth that are getting marketed directly to patients, not unlike medications, I guess, and are getting developed. Now, you might think they're all getting developed in Silicon Valley. That's not necessarily true, okay? So in the Philadelphia area, IBC and Penn Medicine have gone together and developed a Dream IT initiative where they're providing funds to small startup companies through a facility, a little incubator facility over in Center City called Venture Forth, run by Elliot Menchek. Some of you may remember Elliot. He worked for Med Decision, did a whole bunch of other stuff. Elliot's off there doing, working on all of these kinds of things now. So this is happening today. There's a great organization, Philadelphia HIT Circle, that is a group of collaborators and startup folks that are working together to come up with these various concepts in Philadelphia today. About a year ago, and if anybody, I don't know if anybody's had the opportunity to do this, but it is a great experience. I had the experience, the opportunity to attend what was called a startup weekend. In fact, they said it was the first startup weekend health. And what these startup weekends are, okay, is they get you can pay to come in, okay, and spend your whole weekend working with other people on new apps. And at the end of the weekend, okay, their judges come in and mainly for bragging rights, they decide who wins the prize, okay, in terms of the best app. So a great experience, a lot of energy, a lot of interest. Probably 90% of the things will go nowhere. Nobody's running outside the room after somebody puts their pitch together and says, "Oh, I just heard the greatest idea," But those who are interested and persist will come up with their products or have greater success. So for us, we see an opportunity here as well. Now, we have been working with actually more of a creative firm around developing a coaching app. Whether we're going to do this or not, or we'll go with some other company to develop a coaching app, we're not sure. But we think we need to be providing information to our members right on their phone, and not just information about the provider directory and their member card and so forth. But for key members, we believe that a well-developed coaching app integrated with our existing medical management processes will have some significant benefits if it's targeted appropriately. Nobody today, from a healthcare standpoint, I think, expects that you're going to just put an app out there in the App Store and everybody's going to come and want to use it. There are thousands and thousands of healthcare apps out there today. But integrated with your care management organization and perhaps providers, we think that this can help. In terms of providing a more a capability to have a health coach right on your phone, reminding you of various kinds of visits, of when to take your meds, of when to refill your meds, and so forth. One of the concepts here too is to provide a reward system. Okay, so and a gaming system. So the games on the phone are health-oriented games. When you give you points when you finish them, when you pick up your meds, you get points. When you get enough points, you get a coupon to CVS or whatever. Now, and interestingly enough, studies have shown that people will engage with these kinds of applications, particularly if there are rewards. But those rewards don't have to be that significant. Oh, did we run out of juice? All right. So, but it's very, very exciting what's going on here, but very challenging potentially too. How do we figure out what our patients and members really want, okay, and will really use? Are we confusing them? You as a provider might recommend one app to them. We as a health plan recommend another app to them. How are they going to understand it and know where to go? How do we manage the challenge between health literacy and too much information? Somebody mentioned, drinking from the fire hose, Jennifer, I think. There is so much information out there. How do we manage and get the right information personalized to that individual about what they really need? How do we give a consistent message? Could we agree as plans and providers on what tools to use? Okay, so wouldn't it be great if I pay for a tool as a plan and you as a provider in a practice order that for your patient and talk to your patient about using it? That would make a lot of sense, wouldn't it? And then, of course, with social media, there are a lot of privacy concerns, but the fact is we all know from, let's say, whatever it is, smoking cessation, okay, that if you have a community of people who are rooting for you, to change that habit, okay, that you're much more likely to be successful. A great opportunity with social media, okay, but great challenges as well. So I probably didn't answer any questions, probably put more out there than I could ever answer. But these, I think, are some of the challenges that are facing us as an industry. We as a health plan who wants to stay engaged with our members and work with our providers are looking for those opportunities on how to do that and how to leverage these tools, how to leverage this space, entrepreneurial startup innovation space to really enhance the care that our members get, make sure they do get the right care, and ensure that we are improving their wellness. So thanks for your time today. And now I think we take questions, right?
Okay, I'm Jack Hueter. I'm the tag team person that Laurie mentioned. So let's open it up for questions. I have some that I'll post, but just want to open it to the audience first. Okay.
Can you go to the microphone? Martin.
Sure. As far as the texting information that you're receiving back as an offering from your patients, is any of that information pertinent or can be added to the survey that you've already put in front of your patient? And can you capture that and do anything with it?
Sure. As far as capturing the survey comments, and we have two ways that they can provide information free texted. We have a survey, if they want to put in a suggestion or comment, and then we have another one that actually is a patient safety survey as well. So they can go to different people. So it's actually fully configurable on how you set it up. The information just comes in as the free text form. So, we can do anything with it. You can download that to an Excel spreadsheet. You can do whatever you want to it. We do, on our side, we put in processes in place on who gets the information and how they're going to respond to it. So they can go directly back to the patient, or you do have the ability, although we don't tend to use it, where you can actually communicate directly back to the patient via the system. We just prefer to have a more hands-on approach and do it face-to-face. Mm-hmm.
I think we have a question over there.
With the processes that you've put in place, how has it impacted your HCAP scores?
Well, that's a good question. So, our HCAP scores, whenever we put something like this in place, we always see a bump in our HCAP scores. And it was actually something I thought I'd run out of time to talk about. But, one of the things is we can put the tools in place, but it's only as good as you use it and you enforce it. So on those units where we see really good nurse manager leadership and follow-up, we see increases in their HCAP scores, but in those areas that we don't, you'll see a bump and then it'll kind of go down. Overall, we've done pretty well with our HCAP scores, but, there's a lot of initiatives that go into that. But if we do focus on something in particular, like medication education or nurse communication, we will see a little bit of a difference on that.
Okay, Nancy? Here, Nancy.
I have a question for you about the the work that you do in the hospital to help people get engaged, are you seeing any evidence that that's carrying forward as they're discharged and at their home? Are they more engaged in their discharge activities?
So with the Good to Go product that we implemented, as I stated, we don't, it's not 20% yet in terms of listening to it. It's too soon to tell if we've seen any decrease in readmission rates or any improvements in HCAP scores because we've only been doing it a month. But those are the metrics that we're going to be looking at as we evaluate the program.
And Kristen, do you see any opportunity for the Get Well Network to help in that area?
Actually, quite a bit. There's a part of the product that we haven't implemented yet called Get Well at Home. And so the idea behind that is that it will actually be sort of in our portal solution, which we're actually in the process of creating our portal now. We are a Cerner shop for in-house, but we're not outpatient. We're something else, and we're sort of a best in breed. So our portal solution's been a little bit complicated, but the Get Well Network solution will sit within that and sort of provide some of that continuity between their inpatient experience and once they go home. So they'll be able to see the videos that they saw. They'll be able to still get the same medication, access to our formulary. They'll be, we're going to put discharge instructions there. So we're hoping that whole solution, once we put in place, sort of will help with that, because I think right now we're not there yet. We're not as good as reaching the patient once they're at home.
Can I ask one more question?
I would just add, the teach back strategy that I described. Over the course of the several years since we implemented it, we have seen a 20% reduction in our CHF readmit rate. So deploying that strategy through the hospital, when you think about 2,000 nurses, it's a pretty large scale operation. But we have seen over time that we've seen that 20% reduction in CHF readmit rates.
My question's for Joe primarily. The question is, how much of what you're doing in this space in terms of engagement do you view as sort of must-do, sort of competitive strategy versus sort of experimenting in this area to find out what's working?
That's a great question, Wayne, and I think it's part of both. Okay, I think it's a little bit of both. I think certainly our competitors, other plans out there are implementing apps and looking at the same space to be effective. But I think there's we're also dipping our toe in the water to better understand what it is that our members will get strong uptake with our members and move the dial in the right direction. Again, we just see this as the time is not exactly right now, okay? But I would say in the next 12 to 18 months, if you're not involved in this space, we're taking advantage of tools in this space, you will be at a competitive disadvantage.
I do have a question for Joe, and maybe, and Susan, you would be able to answer it as well. But my question, you mentioned social media and privacy, but privacy, it really goes beyond social media. It's just and I'm really wondering how you deal with the challenges of the regulations that require you to keep information private. So as a patient's moving across the care continuum and they've got behavioral health issues and they elect not to share that information, and yet the health system and the health plan are increasingly responsible for the person. How are you overcoming that issue?
Well, I think in a couple of ways. Number one, we need to understand exactly the privacy issues, and let me tell you, they are complex. And I had the experience the other day of talking with somebody from our compliance department who, when we said, well, can we use the last four of the social for the individual to validate, no way. okay, because there are algorithms now that can figure out a lot more about that social with a few pieces of information to the whole social from the last four of it, you know. So there are those challenges. But I think that the other piece of it is that we have to develop an infrastructure also that really enables us to ensure that members have authorized us to communicate with them in a certain way. In fact, we want to know that because we want to know what, not just from an authorization standpoint, but from a preference standpoint. If you don't want text messages, we don't want to be sending you to them, even if they're generic. You know, so there's a whole sensitivity that occurs to address privacy, but also effectiveness that we need to have. I'm sure everybody, or maybe some of you hadn't, the in terms of the big data and so forth, the experience, I think it was of Target, where they were using big data to determine what kind of information could be delivered to in circulars, and so they sent out a circular to a household with a family, 16-year-old and so forth, and it sent it to the 16-year-old, and it was advertising maternity information. Well, they had actually used their big data to find out that this young person had gone in and was buying things that would kind of, based on their view, predict that she was pregnant. The father complained to Target and then had to turn around and apologize when he realized that, in fact, his 16-year-old daughter was going to have a baby. So, there's just enormous challenges out there.
Well, we're out of time, but first of all, I want to thank Kristen, Sue, and Joe. I think it was very enlightening, so please join me in thanking them.